Hi, I'm Ira Sahai. I'm back here with another course feed review video with Dr. Shridhar Nagraj. And before I introduce him, I am the media head of TLife.in. TLife is India's biggest, oldest, and only award-winning low-carb platform, from where comes the TLife Diploma course in low-carb nutrition and metabolic health. So I have with me today Dr. Shridhar Nagraj, who is an alumnus of Armed Forces Medical College, Pune, did his post-graduation in anesthesiology from the same institution, has served 33 years in the armed forces in his specialty and various administrative appointments all over the country and abroad before retiring in 2023. Currently, he's settled in Bangalore and is practicing freelancing. He's a D-Life member and a legally certified metabolic health coach too now. So welcome, Sridhar. How are you today?
I'm doing good, thank you.
Shridhar, a very interesting question. You have a defense background. You also are a doctor. Why did you choose to study nutrition at all?
Yeah, so I would say this is kind of serendipitous because, say, during the COVID pandemic, that's when I started checking out the social media and all. And I followed multiple Twitter handles. Most of them were from abroad. And slowly, as you go deeper into the rabbit hole, you find out, that these guys are advocating mostly non-veg and something which is like say beef and ribeye steaks, which is really not practical in India. As I got deeper into it, then I hit Anoop's handle straight away, and then I went through his timeline, and it sounded very different. It sounded very scientific. It was very logical. And then I checked out his course. Then I checked out other metabolic nutritional courses which are from abroad and all. Just checked out the pattern. I found this to be eminently, adapted to the Indian conditions. So I didn't waste time. I enrolled the same day. So,
Yeah, but that is pretty much about the D Life course itself. Why did you study nutrition? Do you agree that you needed to, even as a doctor?
yeah, so what happens is, say in medicine, we study a lot and are trained towards treating diseases when they appear to us. But prevention is also a part of the treatment. But you see, prevention in any field is not glamorous, so it always takes a back seat. Whereas prevention is actually the most important thing. If you go climb a aircraft, all the preventive maintenance, the one which keeps it flying, is the same thing with the body. Okay, so like your diet, your exercise, everything follows from that. So if your diet is bad, any amount of medicines will not is not going to cure it. So the thing is, if you see the disease burden of, say, our country, a lot of it is all this diabetes, hypertension, and all. These all stem from a very bad diet and probably, a bad lifestyle also. But diet is something which everybody eats, so it can be easily modified in their homes without much effort. Uh, and what was the surprising thing was, once I changed over to this diet, I realized that it is equal to or less expensive than the normal diet. Like one feels that कुछ बहुत कुछ different करना पड़ेगा, but it's not. It's actually easier. You probably eat less, and you have much more free time on your hand, and it is easier to prepare, and definitely good for your body. So then the secondary effects are much more, much better. So that's how I then I realized that see, nutrition is taught to us in the medicine as a part of community medicine course, but it's not prominent at all, and the application of it is definitely not taught. Only when you go into, say, higher medicine, where critical care and all, where you actually count the calories and nutrients and all, but that comes much later in life. But for a general physician or a practicing doctor, it is very these things are negligible. So this is a huge gap in knowledge as well as execution, which has to be covered. And I think Anup has also taken a lot of effort. He has done this over last 10 years. So probably, he has worked really hard. If you go through the course, it's so well structured. There's a lot of, the all the chapters and all. They are very sequential, logical. easy to understand, and I find that towards the end it slowly moves into the practical aspect of it. And then I realized, this was something I was missing. And if I study a lot, so I guess if I'm missing it, I'm sure lots of the other doctors are missing it too. So I mean, that way.
Actually, this is what I wanted to ask you. And just before we proceed, this entire you've spilled some real gems, in your words, through your words, actually, that prevention is what keeps everything well oiled and running. I mean, that's the major part. So people do not understand that food actually is the medicine.
Correct.
And if you are on pills, that is the medicine that you should be looking for. It should be the first line of intervention, because we have 3,000 plus combined success stories of, I think, every metabolic syndrome on our forum. And, we keep tweeting about it every day. And independently, our coaches are all out there and, doing their bit. And, every kind of metabolic syndrome is probably listed there. So also when Anup started basically he started talking about low carb in 2011 on international forums. And back then there was nobody talking about low carb as such in the Indian context, at least. And here it was very difficult because 40% vegetarians, maybe 50% or even more, because even the non-vegetarians
It's a
eat
very
very little
difficult
meat.
field to penetrate.
Yeah, yeah. So people were rehashing the Western model of keto, of beef, bacon, and eggs, and they were failing. Till Anup came on the horizon, at least for India, there was nowhere mentioned, nobody talked on any of the forums about 100-gram carbs per day. On an Indian vegetarian diet, this was especially very complex and difficult to do. So when he started talking about it in 2011, and lots of people followed him and they saw the results. And practically in 2014, when the DLife Forum was launched, all of these people just from all these UK-based and other international forums, it just came on to DLife. So yes, you're right there. When he came, and I totally agree with you that he's kind of pioneered the entire movement in India. So, Shridhar, tell me, now that you are a legally certified metabolic health coach, besides being a doctor, how does it feel? And what are the things in the course that have impressed you the most?
Yeah. So the thing is, I've been practicing medicine for the last 33 years. One has to always keep learning, and this is something, this is a huge knowledge gap which this course has covered. Now, the thing is, uh, what is impressive about this course is it is suitable for a medico as well as for a non-medico who just needs to, brush up on his biology, how the human body works, the physiology, and the entire gamut of things, how it goes into the disease process, and where to make the interventions so that one doesn't move towards the medical treatment part of it and tries to prevent it, or tries to reverse whatever is already happened. So that way, the course is structurally very well designed, and I feel that anybody who feels like either having making a change to his practice, or even changing their own lifestyle in any way, they would benefit massively from just joining this course, or at least join the forums part of it, and start off from there, and or just read. I feel that tweets of, say, Shashi, Arun, and Anup, if you just follow those tweets for next 30 days, you will get a very good idea of where the things are going. And I don't think people could resist joining this course after that, because it makes a lot of sense after that. Then the second part of it, the resources. Like, one would think that there are just about 5 items to cook in a vegetarian meal. How how do you make a menu out of it? You can't eat boiled paneer or eggs every day. But the thing is, once you go through the course, you realize that there's such a variety. Probably you don't have to repeat it even in a month. So the entire thing is, so practical that I feel that anybody who has any intention of either improving his own practice, or trying to improve the family's health or anybody around him, should just join the course, go through it, and they would massively benefit from this.
Mm. Shridhar, what would you advise to doctors like you or other professionals who are interested in studying nutrition, especially doctors, why would you say they should do this course?
So what happens is, like, say, see, the first thing about in medical practices, you come across a patient, he tells you, I have certain problems and all. You try to control the situation in which he is in. But the thing is, there's a lot of background work to be done on this, which many of the doctors are busy in their practice and all, which this thing doesn't strike their mind straight away. But I would say, like, say somebody who has come for bariatric surgery. I mean, this is the first thing they should be offered to them. There are lots of edge cases which probably require the surgery. But I guess, I mean, I have done a lot of them, but I would feel that at least 50% of them could be straight away tackled by this. And then slowly over a period of time, those who don't respond, those who have some other hormonal issues or some other problems, they are the ones who should be guided into the surgery part of it. Also, this same thing, say like obesity, hypertension, diabetes. See, these comorbidities lead to other illnesses during the, say, surgical period or during the treatment part of it. So if anybody who has this illness and is pre-treated prior to a surgeries, he would massively benefit from a shortened post-op period, faster recovery, and a better overall health. Probably, lesser hospital bills in the thing. And you see, these things are, again, the thing is, it is not glamorous. So if you go in for the preventive part of it, there are a lot of things down the line which will sort themselves out. That is how this course is really really useful to a doctor who can apply these concepts prior to going into an actual intervention.
Yeah, makes a lot of sense. And I think 19 doctors are now enrolled with us. So that's a huge number to begin with, because that clearly says that there is a need, there is a gap, between pills and, the outcomes that we want to
Yeah.
achieve. And that is where nutrition comes in. So for those who want to know a bit more about our course, we have the largest content on low carb nutrition and metabolic health uh, in terms of CPD hours. We are CPD SO UK accredited with the global best of 60 hours credit. And our course is legally attainable in India. It is also the SMHP approved CMHE provider. Course gives free access to dlive.in platform, which has about 3,000 plus combined success stories, 2,000 plus original low carb, keto, vegetarian, and non-vegetarian recipes. There are about 150 plus podcasts, including the Metabolic Health Conferences 1 and 2. It's, as I said, the largest content on low carb in terms of the platform and also in terms of the course. In the course, there are about 800 references, 200,000 words, 60 relevant videos, lifetime access, and there is no recertification clause. We have one of the biggest libraries of low carb resource materials, and there's a robust forum of discussion and long threads on cases where you will find your mentors and moderators answering your queries all the time. So if you're taking a client, if you have a client query, you want some help, you need some assistance, you'll be given all of that by your
Absolutely.
mentors.
Yeah.
And there's a 24/7 WhatsApp community support where there's a lot of bonding, learning, and fun.
Yeah, that is one
And
thing. The forum and the WhatsApp group are really, the hand holding is really, really good. Usually, these communities are very competitive. One really doesn't want the other guy to come up. But in this case, the entire thing is rising together. It really is a very different feeling,
mm,
I would say. So
yeah, I would say that I would agree to that, because the moment you enter the community, it's a different vibe and everybody is out there to help you. We
correct.
don't compete with the family members. We
Yeah.
don't compete with the family. So we are all out there to help. And it's such a warm community, as I also wrote yesterday on Twitter. So this has been a great review, Dr. Sridhar, and I thank you so much for, coming and speaking to me this afternoon. And before I just sign off, let me tell you that Bee Life, when it was launched in 2014, it catered to Indian low carb specifically, because Indian low carb didn't fit in the Western keto model of beef, bacon, eggs. And that was the point why Anup founded Bee Life in 2014. And all the recipes are India centric, Asia centric, especially tailor made for vegetarians. And they've been posted by our members after trying and tasting. every macro is auto-computed, so you will know exactly what you're eating. So it's a great, big
That is
community
one
of
thing.
low
It's
carbers.
quite a revelation actually, because as you are completing the course and you start posting the recipes and all, you realize so much hard work has gone into the back end. So I mean, and it is so scientific and logical. One doesn't have to. One does it, and then one realizes that where one is going wrong.
Yeah,
So
yeah,
it's a very good thing.
yeah.
All credit to Anup.
Yeah, I agree with you, Dr. Sridhar. So thank you again. Thank you for coming and speaking with me. And if you want to follow Dr. Sridhar, how can they reach you, Dr. Sridhar?
I'm on X, Twitter, as well as Optimum Lifestyle, and I currently don't have a website or Instagram. I mean, as far as
But you can maybe spell out your Twitter handle or something in case
yeah,
somebody
it's,
wants to get in touch with
it's
you.
Optimum as in Optimum and Lifestyle with just Y's. L LYF. I mean, I probably have to. There are
No
some.
problems. When we upload this video, we will put out Dr.
Yeah,
Sridhar's Twitter
yes,
handle
please.
as well. So if you want to consult him, if you want to get in touch with him, you please, click on that handle and you will be able to contact him. So thank you so much again,
Thanks for having me.
Sridhar. Thank you for coming and speaking with me. What a pleasure. I'll see you around next time and in another video. This is Ira Sahai signing off. Bye-bye.
Thank you.